People believe that if a surgery is common, it must be completely safe. I used to hear that assumption almost every week from patients sitting across from me in the exam room. "Doctor, it's a routine procedure. Everyone gets it done. My neighbor had it and was fine." And in many cases, they're right. Modern surgery has saved countless lives and restored independence to millions of older adults. But here's what nobody tells you. A surgery can be common and still carry important risks. A procedure can be successful and still require careful consideration. The uncomfortable truth is that some seniors focus so much on the potential benefits of surgery that they never ask enough questions about the recovery, complications, or alternatives. That's why today's conversation matters. Not because surgery is something to fear, quite the opposite. The goal is to help you make informed decisions and understand the questions every older adult should ask before going into the operating room. My name is Dr. Michael Anderson. For more than 25 years, I've cared for older adults facing a wide range of medical challenges, from heart disease and diabetes to joint problems and neurological conditions. During that time, I've worked closely with surgeons, rehabilitation specialists, physical therapists, and families navigating difficult decisions. One thing I've learned is that the best surgical outcomes often begin long before the operation itself. They begin with education, preparation, and realistic expectations. Today, I want to discuss 5 common surgeries many seniors encounter and some of the hidden considerations that deserve attention. Before we begin, let's establish an important principle. Surgery is not simply an event, it's a process. Many people focus entirely on the day of the operation, but the body sees surgery differently. To the body, surgery involves preparation, healing, recovery, rehabilitation, and adaptation. Think of it like repairing part of a house. The repair itself may take only a day, but restoring everything around it often takes weeks or months. Understanding that bigger picture can help people make more informed choices. The first surgery is knee replacement. This procedure has helped millions of older adults regain mobility and reduce pain. Many patients tell me they wish they had done it sooner. That's the positive side of the story, and it's important to acknowledge. For the right patient, knee replacement can be life-changing. But here's where things become interesting. Many people underestimate the recovery process. They imagine waking up with a new knee and immediately returning to normal life. In reality, recovery often requires commitment, patience, and physical therapy. What happens inside the body is that tissues need time to heal, muscles need to regain strength, and the nervous system must adapt to changes around the joint. I've seen patients become frustrated because they expected instant results. One gentleman told me, "Nobody warned me the real work started after surgery." Fortunately, he stayed committed to rehabilitation and eventually achieved an excellent outcome. Were you aware that recovery often plays just as important a role as the surgery itself? The second common surgery is cataract surgery. This is one of the most frequently performed procedures in the world, and for good reason. It can dramatically improve vision and quality of life. Patients often describe colors appearing brighter and everyday activities becoming easier. However, some individuals assume that cataract surgery automatically restores perfect vision under all circumstances. That's not always the case. The hidden consideration is that other eye conditions may still affect visual outcomes. Macular degeneration, glaucoma, and retinal problems can influence results. I remember a patient who expected cataract surgery to solve every visual challenge she faced. After a thoughtful discussion, she developed more realistic expectations and felt much happier with her eventual outcome. The lesson wasn't that the surgery failed. It was that understanding the complete picture matters. Have you ever assumed a medical procedure would solve more than one problem at once? The third surgery is hip replacement. For many seniors struggling with arthritis and chronic pain, this procedure can restore independence and mobility. I've watched patients return to activities they thought they had lost forever. Gardening, traveling, walking with friends. Those benefits are real. But here's the hidden challenge. Falls remain a major concern during recovery. After surgery, balance, strength, and confidence may take time to return. One patient was so excited about feeling better that she attempted several physically demanding activities too soon. Fortunately, she wasn't seriously injured, but the experience delayed her recovery. What happened next surprised even her. Once she slowed down and followed a structured rehabilitation plan, her progress accelerated significantly. The lesson was simple. Healing has its own timeline. Have you ever found yourself wanting to rush a recovery process? The fourth surgery is coronary artery bypass surgery. This procedure can improve blood flow to the heart and may be life-saving in certain situations. Patients often feel grateful for the opportunity to address serious cardiovascular disease. Yet one misconception appears again and again. Some individuals believe surgery alone solves the problem permanently. In reality, surgery often represents one chapter, not the entire story. What happens inside the body is that the underlying factors contributing to heart disease still require attention. Nutrition, physical activity, blood pressure management, cholesterol control, sleep quality, and smoking cessation remain critically important. I recall a patient who referred to his bypass surgery as a reset button. I gently explained that it was more like receiving a second chance to protect his heart. Years later, he thanked me for that perspective because it motivated lasting lifestyle changes. Did you know that long-term habits often influence surgical outcomes just as much as the procedure itself? Now, let's discuss the fifth surgery, spinal surgery. This is perhaps one of the most misunderstood areas of medicine. Many people suffering from back pain hope surgery will provide immediate and complete relief. Sometimes surgery is absolutely the right choice. Severe nerve compression, spinal instability, and certain structural problems may require surgical intervention. But here's the hidden consideration. Not every type of back pain responds equally well to surgery. The spine is an incredibly complex structure involving bones, muscles, nerves, ligaments, and joints. One patient came to me convinced surgery was his only option. After a thorough evaluation, he discovered that physical therapy and targeted exercise provided substantial improvement without an operation. Another patient truly needed surgery and experienced remarkable relief afterward. The difference was not the procedure itself. The difference was identifying the right treatment for the right problem. Were you aware that similar symptoms can sometimes have very different solutions? But that's only part of the story. Across all 5 surgeries, one factor repeatedly influences outcomes more than most people realize: overall health before surgery. I often compare surgery to climbing a mountain. The stronger and more prepared you are at the base, the better your chances of reaching the summit successfully. Nutrition matters. Sleep matters. Physical activity matters. Managing chronic conditions matters. Small habits, big consequences. Throughout my career, I have noticed another pattern. Patients frequently focus on asking, "What are the benefits?" That's a good question. But equally important questions include, what will recovery look like? What complications should I understand? What alternatives exist? What happens if I wait? These conversations often reveal information that changes how people view their options. One patient I remember vividly was a 74-year-old woman named Margaret. She was considering knee replacement surgery and felt overwhelmed by conflicting advice. Some friends encouraged her to schedule surgery immediately. Others told her to avoid it at all costs. During our discussions, we carefully reviewed her symptoms, lifestyle, goals, and overall health. Together, we developed a plan that included strengthening exercises, weight management, and physical therapy before making a final decision. Several months later, she still chose surgery, but she entered the process stronger, more informed, and more confident. Her recovery exceeded expectations. The lesson wasn't that surgery should be delayed. The lesson was that preparation can significantly influence results. So what practical steps can you take if you're considering surgery? Start by asking detailed questions. Understand the expected benefits and the potential risks. Learn what recovery will require from you. Discuss medications, existing health conditions, and realistic outcomes. Ask whether non-surgical treatments have been fully explored. And perhaps most importantly, focus on improving your overall health before any procedure whenever possible. You may also want to ask yourself a few important questions. What are my goals? Am I hoping to reduce pain, improve mobility, increase independence, or address a serious medical problem? Do my expectations match what the procedure is likely to achieve? Have I fully understood the recovery process? These conversations can help you become an active participant in your healthcare decisions. One of the most inspiring patients I've ever worked with was an 80-year-old retired teacher named Robert. He needed a hip replacement and was understandably nervous. He worried about complications, recovery, and losing independence. Rather than focusing solely on the operation, he committed to preparing himself physically and mentally. He improved his nutrition, performed recommended exercises, managed his chronic conditions carefully, and learned exactly what recovery would involve. After surgery, he followed his rehabilitation plan consistently. Months later, he was walking comfortably, traveling again, and enjoying activities he had nearly abandoned. The most powerful lesson from his story was this: preparation often creates confidence, and confidence supports recovery. If there is one message I hope you remember from today's discussion, it is this: the safest surgical decision is an informed surgical decision. Common procedures can offer tremendous benefits, but understanding the full journey, from preparation to recovery, helps people achieve better outcomes and avoid unnecessary surprises. Today we've explored knee replacement, cataract surgery, hip replacement, coronary artery bypass surgery, and spinal surgery. None of these procedures are inherently good or bad. They are tools, powerful tools. The key is knowing when they are appropriate, understanding their limitations, and preparing thoughtfully. As we conclude, I encourage you to stay informed, ask questions, and take an active role in every healthcare decision. Knowledge is not a substitute for medical care, but it is one of the most valuable tools you can bring into any conversation with your healthcare team. I'd love to hear from you. Have you or a loved one ever undergone one of these surgeries? What was the most surprising part of the experience? Share your thoughts in the comments below. Your story may help someone else make a more informed decision. Thank you for spending this time with me today. Take care of your health, stay curious, and remember that the best medical decisions are often made when knowledge and preparation work together.